For many folks, eating is a walk in the park. You probably even look forward to it. But for others, eating a meal is the most dreadful part of their day. And that's because eating disorders, which aren't really talked about a lot here in Montana, are a bigger issue than you may think.
It had felt like the worst it had ever been, and it didn't feel like I could pull myself out on my own.
Gabby Hedges is a former patient of Eating Disorder Center of Montana. She's been battling anorexia for over 10 years.
I could feel relationships crumbling. I could feel myself becoming more isolated. I was consistently unhappy, depressed, anxious, and I knew it all connected to my eating disorder.
Which is why in March of 2024, she decided to seek help.
I wanted to chat with and connect with individuals who really got it. I could talk to my friends and my partner all day long about what's going on in my head, and they would sympathize, but they would never fully understand, like someone who's struggling with the same thing.
Gabby isn't alone. According to the National Eating Disorder Association, 28.8 million Americans will have an eating disorder in their lifetime. An issue Eating Disorder Center of Montana, or EDCMT, recognized 11 years ago.
There was nothing provided in our state previous to us forming EDCMT.
Elisa White is the executive director of EDCMT. She tells me this organization initially started as a for-profit business and has been able to help hundreds recover from eating disorders. In fact, they're currently serving upwards of 40 patients at a time, and there may even be more folks who need the help but just aren't getting it.
There's a stigma around seeking treatment for mental health. So oftentimes individuals that have an eating disorder are really suffering in silence and alone.
Which is why, as of November of 2024, EDCMT transferred to a nonprofit organization.
As a nonprofit, we are committed to reducing financial barriers, increasing access to care, more community outreach and education, and then training healthcare professionals and our staff.
Services including partial hospitalization or intensive outpatient services, where folks can experience food exposure, cooking groups, trauma-informed yoga, expressive arts therapy, and more, now highly accessible in our community.
When I saw this, I was like, this is incredible news.
Because for Gabby, getting treatment turned her life around.
I am absolutely thriving. I feel more vibrant and radiant. Like I said, I landed a new job, which had been my goal for probably the past 18 months, but I just hadn't been able to get myself there.
For more information on ways you can access help, visit our website. In Bozeman, Cassidy Powers, MTN News.